Hi, everyone. My name is Carah Solemsaas, and I am a Master of Public Health candidate for the University of Nevada, Reno, as well as the Health Equity Intern for the Nevada Public Health Training Center, here today to present to you all on the key findings related to the Nevada Public Health Workforce Health Equity Needs Assessment. So before we get started, I just wanted to give a special thank you to the Western Region Public Health Training Center for funding this project and the following members of the Nevada Public Health Training Center team who took the time to help distribute, develop, and analyze the findings from the 2021 needs assessment. So we have Tamara Tellis, Taylor Lench, Gerald Dermott, and Kelly Morning. So just to start off, a little background information about the agency that I worked with. So the Nevada Public Health Training Center. They are a part of the Western Region Public Health Training Center and the School of Community Health Sciences at the University of Nevada, Reno. They also expand research by conducting assessments, such as this one that I'm presenting today, that target various health needs statewide. They also provide trainings and educational opportunities, and they form key partnerships to enhance Nevada's public health workforce overall. So a little about the background focus for the health issue at large is health inequities within the public health workforce. So that is our focus here today. So this was baseline data that really captured those health equity needs of the public health and clinical workforce for our communities. This baseline data helped us to identify the current inequities that's faced in the workplace. And it helped us to provide audience members with the tools to begin implementing a health equity lens when restructuring organizations. So my specific responsibilities were to develop a comprehensive report on the data findings that we had here, create an infographic, and then present the findings at the Northern Nevada Diversity Summit and the Health Equity Webinar Series within the Nevada Public Health Training Center. So methods and participants. So the Nevada Public Health Training Center developed and distributed this needs assessment to public health and clinical professionals statewide. And so it was originally disseminated in December and then a second time in February of 2021 with the participation of 562 respondents. So we recruited people through targeted emails to state and county health professionals, including public health and clinical professionals from coalitions, nonprofit organizations, and healthcare organizations across the state. So this presentation will include some project outcomes that encompass key findings of the demographic composition of respondents, the organizational and community level of addressing health inequities, and the individual level, which includes the individual experience in the workplace and addressing those health inequities. And finally, we'll talk a little bit about action plan recommendations for leaders. So the demographic composition of participants included 86% were heterosexual or straight, 75% were female, 78% had a bachelor's degree or higher, 44% of respondents represented minority groups, 41% were between the ages of 30 to 49 years, 52% were public health professionals, and then 77% were employed by government entities. So looking at the organizational and community level, one of our key findings here was 47% of respondents feel that their organization has no focus or not enough focus on addressing health inequities. So you can see here that we have some work to do in this area to really bring that up as high as we can. Within working with communities and external partners at the organizational and community level, 63% worked directly with community residents. 66% selected COVID-19 as a top priority health issue, which makes sense given the time we disseminated this and given the state of the pandemic. And then 50% of respondents said that they prioritize housing, income, food security, and occupational status based on these social and economic conditions that impact health within the communities that they serve. So again, you can see how there's a trend and it's in conjunction with COVID-19 being a priority health issue as well. So individual levels. So we took a look at training areas And here we found only 19% of respondents reported receiving training on how to organize communities to advocate on their own behalf to improve conditions of their neighborhood. So we have plenty of room for growth here within these training areas that just haven't been provided or maybe haven't been prioritized for staff. So another one that's on the lower percentage end here is how to research, understand, and develop policies that impact the social, economic, and physical conditions. So when we're thinking in terms of health equity, this area, as well as organizing communities, are really important to advance health equity. So another piece of the individual and level is the organizational culture. So 44% of respondents have observed some form of discrimination in the workplace. So whether that was related to their own form of discrimination or someone else's. And that is a very significant finding that we found here. And as you can see, race, ethnicity, and nationality was the top one at 26%, and then age was the next highest at 24%. And then the third here, of course, gender identity, sexual orientation, and sexuality, and so on and so forth. And so even just looking at this one slide alone, there are different opportunities that we can address this within organizations to really improve that culture. And then lastly, here are some 2021 action plan recommendations specifically for leaders of organizations. And so based on some of the indicators I had just shown you, those really helped us to identify these priority areas for organizations to really work on and improving health equity. The first one is interviews and performance review areas. So some action steps for leaders may include utilizing various toolkits focused on supporting the efforts to hire a more diverse workforce, so having that representation within the workplace. Tailor performance reviews to assess staff and departments. Work on addressing health inequities, so how are we measuring our work? And then the last one is to implement workforce policies for creating diverse search committees, as well as requiring diversity-related questions. So the University of Nevada, Reno, their Office of Diversity and Inclusion has a lot of resources in regard to this, and so I provided those to the right there. The next priority area is training, guidance, or mentoring. And what we had said for action steps for leaders include promoting health equity training opportunities as professional development opportunities for staff, as well as evaluating organizational progress using Washington County Public Health's Health Equity Lens evaluation tool. So they're within Oregon State, and they help to provide that evaluation for organizations that are looking to advance health equity. And I have those resources there to the right as well. And then the last priority area is organizational culture. So the first action step is to implement policies requiring annual cultural competency trainings, and then having that with subsequent equity-related trainings for all staff. The next area is to identify staff members to create a task force that's responsible for streamlining any type of discrimination in the workplace and the reporting of that, as well as educating staff on those processes. And then the last one is to adopt workforce policies that really model UNR's equal opportunity and Title IX policy on unlawful discrimination, as well as requiring leaders to really educate themselves on engaging with difficult conversations, such as structural racism. And you can see to the right there, there's a couple of resources. A lot of the resources provided are either within the University of Nevada, Reno, or they're from other universities and national organizations. And that is the end of my slideshow. Thank you so much.